Hi, everybody. Thank you for inviting me to be here. Cristina, muchísimas gracias. I am really, really lucky to be standing up here. I think I'm in a room full of advocates and people that have worked tireless hours to get this law enacted, and you deserve our gratitude and our thanks. So a round of applause to everyone in this room. So I'm here to talk to you a little bit about how small businesses will be impacted by the new law. Senator Durbin, the senior senator from the state of Illinois, has a long-standing commitment to small businesses. It really did start with his conversations with folks in the state of Illinois throughout the entire state. He heard many, many concerns around the cost of health insurance for small businesses and the fact that they were continually going up. So back in 2006, 2005 maybe, he started trying to figure out what type of legislative effort can we build, what type of legislative coalition can we build to address the healthcare needs of small businesses. And many years later, that has now become part of the new health reform law. Many people in this room know that small businesses are truly the backbone of our economy. Small businesses like mom and pop shops, the family businesses, businesses that have been around for generations on the corner of our communities have always been the reliable job creators in our country. In fact, small businesses created 14.5 million new jobs in the last 15 years alone. This represents nearly 2/3 of all the new jobs created in the U.S. But we all know, and we hear from our neighbors, and we hear from our family and friends, that they're really trying to keep their head above water when it comes to healthcare premiums. It continues to rise, and they continue to not be able to keep up. Last year, the New York Times reported that small businesses will be seeing their premiums go up on average about 15% for the coming year. That's double the rate of the previous year's increases. When nearly 75% of small businesses cite high premiums as the reason why they cannot offer health insurance to their employees, we know we need to do something about it. They're already struggling to stay afloat in this really difficult economy. Americans are trying to find work and trying to stay employed, so we need to do what we can to provide small businesses the opportunity to make it possible to not only offer health insurance, but to continue to grow as small businesses in the community. So right now, if you think about a small business is ranging from a 5-person team to a 20-person team, one employee can have a tremendous impact on the ability to have health insurance. If you're offering a small employee health insurance coverage and they're married and their wife comes down with a diagnosis of cancer, we know that that health insurance premium can skyrocket because it's legal for health insurance companies to do it. Well, this situation is not felt by large businesses. The large businesses have a larger pool of employees that are able to spread that risk, and large business employers are able to offer more employees their health insurance. So there are many advantages felt by large businesses that is not felt by small businesses. As a result, we're seeing our small business workers pay 18% more on average for their healthcare premiums. And they've seen their healthcare costs grow by 130% since 2000. It's an unacceptable situation, and this new health reform law will make the possible changes to stop that. So the new law is truly historic for our country. We just witnessed the largest piece of social policy legislation in decades, but it's really more than that. I think it's a confirmation to small businesses across the country that we're listening, that we're trying to respond to your needs and make a difference for the future. So one of the main components of the new law is the Small Business Healthcare Affordability Tax Credit. It's $40 billion in tax credits that will be possible for 4 million small businesses across the country. That's more than 60% of small employers. It's going to be able to make health insurance more affordable for small businesses to be able to offer health insurance to their employees. And it's available this year. So small businesses right now that are purchasing health insurance can claim this on their taxes and get money back as a result of what they're doing. These changes are going to help more small businesses qualify for the tax credit, and it'll slowly phase out as small businesses intend to grow and have the necessary resources to offer more health insurance to their employees. In addition, starting in 2014, the new law is going to establish an internet portal where individuals can easily access information about affordable and comprehensive coverage options. This is actually based on a concept that Senator Durbin worked with for years on a bipartisan basis with Senator Snowe from Maine. This is the Small Business Health Options Program. I'm sure you heard about it from Mr. Koo earlier today, but I wanted to basically put it in a way that helped me understand what the concept was. Who here, when you're purchasing airline tickets, goes to like Expedia, Kayak, Orbitz, something like that? Right? We love it. You can put in how much money you want to spend, where you're going, what time you want to leave, and bam, 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 your options come up. And you can choose to go based on the time, or you can choose to go based on how much you want to spend. That's what we're trying to do for health insurance. We're trying to make it easier for people to understand what it is you're actually buying. So you'll be able to input your information, input your address, input what you're looking for, whether it's the doctors that's your priority or whether how much you want to spend is your priority, and you'll be able to get the options necessary for you to purchase health insurance more easily and in an affordable manner. That will give small businesses access to affordable health plans and the advantages that large businesses have today. Lower rates, like what big businesses pay. Stable pricing from year to year, so you're not seeing your premium skyrocket in 6 months because one of your employees got sick. Lower administrative costs. Right now, small businesses pay more of that administrative cost burden because they're smaller. They're having to deal with these people, the insurance companies, more than a large business would that has a human resource department or something. And the choice of quality plans for their employees. So we're just trying to make sure that small businesses across the country that are employing millions of Americans have the same advantages that large businesses have. So the new law is not only going to do that, it's going to do more. I think it's trying to look at the resources within the small business community to ensure that we're responding to the needs. So it's engaging small business administration resource partners like women's business centers, minority business centers, veterans business centers. These are the folks that small businesses in our community talk to every day, get information every day. Daniel mentioned navigators. The role of a navigator is especially important. I think anyone can try to go on the internet or try to find a pamphlet, but how do we know what's reliable information, particularly when there are millions of sources of information nowadays with technology? I think this navigator will be a trusted source in the small business community to educate small business workers about how to acquire affordable health insurance. So we're really looking forward to that coming to fruition. It's also important to note that the new law is meant to make offering health insurance easier for small business employers, not more burdensome. So the new law exempts employers with fewer than 50 employees from any employer responsibility policy. It's important to note that this means that 96% of firms in the United States, or 5.8 million out of the 6 million today, will be exempted. That's a huge number. In addition, it improves the transition into the employer responsibility policy by subtracting the first 30 employees of your business. So a lot of people were saying that, oh, if you're exempting 50 employees and under, what kind of incentive do we have to grow our business to 51 or 52? Well, the idea is you're not going to count your first 30 employees in that employer responsibility policy. So you'll only be, if you choose not to provide health insurance, assessed for those first 21, basically. And I can go into details on that in question and answer. So the benefits of health reform are going to be seen by everyone, and many of us are going to see it this year. Already, we're seeing insurance companies, the guys that were fighting hard not to pass this law, come to the table and work with us now. It's a reality that's set in motion, and they're coming forward and saying, we're not going to wait until September to enact those policies. It's the right thing to do by the American people. We're going to do that now. So right now, they're ending the practice of rescissions, or the fact that they could drop people when they got sick. Insurance companies are also working to implement the dependent policy sooner, so children up to age 26 can have the chance to stay on their parents' insurance. This is especially important for young adults that are graduating college or graduating high school, and they got that first job, but that first job is not going to offer a quality health insurance plan. So they want to stay on their parents' plan, and this is going to give them the opportunity to do so. Later this year, all health insurance plans will no longer be allowed to place lifetime limits on the amount of benefits available. That's huge. All of us are one terrible accident or one terrible diagnosis away from really potentially falling into debt as a result of medical care. We want health insurance that's going to be there when you need it, and this law is going to make that possible. So, is this everything that we want healthcare to be? Is it going to make our healthcare system perfect? No. No law was. But these are changes that are going to help make insurance what every person already expects insurance to be, there for you when you need it. So it's not a perfect law, but it's an important first step, and we have set the ball in motion to do more. This is why I really want to emphasize that it's incredibly important for you all to remain engaged. Without your dedication and your determination, without your phone calls and your letters and your Hill visits, this would not have been possible. And as we try to reform this law and make it better for the future, we need you to continue to remain engaged and continue to lobby your congressmen and your senators and make sure that it's meeting the needs of your communities and your family. So I look forward to continuing to work with you all and making sure that we're implementing this for the future in the right way for the American people.